Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you today the 80th edition of our COVID-19 community briefing. And as you can see, for the 80th, we've pulled out all stops and invited our Chief Medical Officer, Dr. Alan Laird, to join us as well.
It's nice to be with you today.
It's great to have you, Al. We're going to talk to Dr. Laird specifically about the vaccine system and distribution methodology, things like that. But we wanted to get through the statistics first. And again, as we talked about last week, I'm kind of skinnying down these statistics a little bit to try to make them more relevant, more understandable, and meaningful ultimately. So here we go. Our local scoreboard, as it is a Monday, basically the same as we reported before. We've had now 1,601 positive tests of the 7,802 that we've conducted here at Orange City Area Health System. That is a 20.5% cumulative positive rating. What I think is more important, as what you'll hear over the next few minutes, is I'm going to pay more attention to the 7-day averages and the 14-day averages. And so for the last week on our local scoreboard, we've had 197 additional tests. That number doesn't mean anything until you compare it to previous. That is 93 tests fewer than the week before. Of those 197 tests, 38 were positive. And so while the positivity rate didn't drop that much, it was 19.2%, the number of tests that we did drop 33% basically. So fewer people were presenting with cases or symptoms that merited a test. So I look at that as good news. Let's jump then to Sioux County, where we look at the 14-day average. The short story is the rate continues to go down. The rest of the story is not as quickly as we would like, but the 14-day average in Sioux County is 19.1%. That is down from 19.3, which is down from 20.0, which is down from 20.8. So it's good, it's heading in the right direction, but it can be better. The 7-day average is a better number at 15.5% over the last 7 days, but that is up from 13.2. So we'll continue to watch those 7-day and 14-day averages, particularly close to home in Sioux County. Another thing that I'm going to track regularly now is the positive rate per 100,000 population. That is a number that we can compare ourselves to the entire state and to other counties. Sioux County's number for the last 7 days was 401.0 per 100,000. Again, you have to measure that as compared to a previous number. Our previous number was 352, so it did go up a little bit. But when you compare the 401 to the previous 7 days, it is a 19% drop in that. So over the last 7 days, our positive rate per 100,000 has gone down. Again, not rapidly, but negative 19% is better than negative 15 or negative 10 or 0. So that's a good number. The last thing that I will give for Sioux County today is that since last Thursday, we have had 66 additional individuals test positive. And year to date, we're at 4,067 positive, at 12,585. So about 30% from the beginning till now, but I would rely less on that number and more on the 7 and 14-day averages in terms of the current infectivity of the virus, if you will. Stepping back to Region 3, good news in Region 3, the 20 counties in Northwest Iowa, 138 hospitalized patients in that 20 county region. That is down from 150, which is down from 174, which is down from 179. So clearly, and the number before that was over 200. So we're heading in the right direction, no question, from a hospitalization standpoint. Our ICU beds are not unfilling at the rate we want them, but it is 22 ICU patients today as opposed to 23 in our last briefing. But the number on vents has gone down significantly from 17 to 11. So that's good news in terms of Region 3. Iowa, I'm not going to talk about the 1,200,000 and whatever thousand number of tests we've done in Iowa, but I'm going to talk about the 14-day average because I think that compares again to ours here. In Iowa, over the last 14 days, we've had a 15.1% positivity rating. That is down from 15.7, which is down from 16.4. So on a state level, 14-day average, we are heading in the right direction as well. 7 days at the state level is currently 11.1%, down from 11.7, down from 13.4. So on a 7-day and 14-day average, Iowa's going in the right direction, and that is good news. The individual per positivity per 100,000 at the state level is 323. So you can compare that to Sioux County's 401. But the 323 at the state level is down from 377 the last time we reported these numbers. I was not able to get an updated number on the number of Iowa residents hospitalized. The number there was the same number I gave last week, and so I don't have an update from December 9. Deaths, we have had 93 additional deaths since last Thursday. When I look at that, the number is 3,213, but there is no change in terms of the demographic. We continue to have 92% of that 3,213 be 60 years or over. If there is any change, it is in the fact that the 80 plus category is growing. So 57% of the 3,213 is 80 plus. Again, the disease is manifesting itself in age groups that have been consistent throughout, and there really isn't any change with that. So that's it for the stats. Hopefully that's a little bit more digestible version. I'm going to transition now to the local scene and local things going on here. In the hospital here in Orange City, pretty good news. As of this morning, we only had 10 patients in the hospital, 3 of which were COVID or COVID-related things going on. The ER over the weekend was quote unquote normal with minimal COVID activity. Prairie Ridge, we continue to be in outbreak status there. We do have 7 positives at Prairie Ridge. We have created a negative pressure suite. Our testing out there continues. The good news with our 7 positives is they are, at this time anyway, what we would call mildly symptomatic. And we're in the, generally speaking, about 3 to 5 day window. So we're not out of the woods yet with those folks, but right now they're mildly symptomatic, and we are doing everything we possibly can to minimize the spread any further at Prairie Ridge. At Landsmere Ridge, very happy to report that we still have 0 positives at Landsmere Ridge, and the testing environment there is for symptomatic patients only, or not patients, symptomatic residents only at Landsmere Ridge. So that's a little bit of a look locally and a review of statistics. Obviously, if you've been watching the news at all, you're aware that the vaccine is here. We're seeing pictures, on the news of FedEx trucks driving down the road, like that's a new sight, right? But supposedly there's COVID vaccine in those trucks. And so that's a very good thing. We did get some emails last night from Sanford that they're expecting distribution even last night in terms of some of their locations. So I thought I'd give you the latest that we have and have Dr. Laird talk a little bit about the vaccine itself and whether you want to consider getting it. First of all, we want to break this down into two components. The first component is the nursing home component, the most vulnerable population that we have besides frontline healthcare workers. The senior care component, nursing home and assisted living, is being dealt with through what we call the Walgreens structure or the Walgreens model. The Walgreens model will utilize the Pfizer vaccine. The Pfizer vaccine can be given with a 21-day separation, so a minimum of 21 days before the second dose, and that we are staged and ready for that to happen. In addition to the residents at nursing homes and assisted living, it also includes staff. And so when we look at senior care, we're looking at the Walgreens model to address 100% of that population. We will issue no mandate for receiving that vaccine. So if you're a staff member, you do not have to take it. If you're a resident, you do not have to take it. That will be a family and or personal decision that is reached in senior care. We are still anticipating the week of December 27 as that distribution, but we're not in control of that process. But that's still what we are hearing. And again, assisted living is part of this, but assisted living will be second to nursing home. It'll be part of it, but will be second. Walgreens staff will actually administer this vaccine. So it's not only the supplying of the vaccine, but it's also the administration of the vaccine. The second aspect of this is the general population. And as of last week, we are still anticipating 320 doses from Moderna to arrive sometime on or about December 21. Moderna does not have to be kept quite as cold as the Pfizer, and so has a little longer shelf life, but it also has a 28-day window for the second dose. So both vaccines in terms of Pfizer and Moderna have 2-dose regimens. The Pfizer is 21 days apart, not sooner than, and the Moderna is not sooner than 28 days. A question that we had internally last week has now been answered. And that involves under age 18, but we are being advised at this point that age 16 and above are eligible to receive the vaccine. In terms of the 320 doses, again, general population, we will address in priority there how those are distributed. We think there's going to be quite a range of folks that are going to be able to receive the vaccine. If we receive it on Monday next week, we should be able to be giving those doses pretty openly, but it has to be disciplined. We'll start with frontline healthcare workers, doctors, nurses, PAs, nurse practitioners, those kinds of folks, dietary people who are engaged with patient care, environmental service staff, that kind of thing. We will also open this up most likely after that to Landsmere Ridge Independent Living, Pioneer Home, also things like that. And then we'll continue. We still believe after that we'll have some of the 320 left, and then we'll go into more general population. Maybe it's by age group, maybe it's second tier healthcare workers. But the main thing with that is please stay tuned for more developments. Obviously, if we don't get the shipment on December 21, we can't start on December 21. And so we'll go through, look for public service announcements, maybe briefings like this, maybe stuff on the radio, but we'll definitely get that out. One of the things that we want to talk about now is Orange City Area Health System's position relative to the vaccine. And Dr. Laird can kind of share his own personal journey on where he's been with the vaccine. From a health system perspective, at this point, we want to go on record as encouraging you to consider getting this vaccine. words that get politicized a little bit too much are herd immunity and some other things. But please remember that for the vaccine to reach a level of effectiveness, of efficacy, herd immunity even, if you will, we need a lot of folks to get it. Conservatively speaking, in the 70%, maybe even 80% range in Sioux County to have herd immunity in Sioux County. So we definitely encourage you to do that. I'd like to let Dr. Laird talk a little bit more about the vaccine, kind of some of the research that he's done, maybe some of the exposure that you've had. And would you just share with us, Dr. Laird, kind of where your journey has led you today?
Thank you, Marty. I would enjoy doing that. Like many of you out there, I certainly had concerns about a vaccine that was developed very rapidly, that maybe we didn't know a lot about, and just exactly what the mechanism was of how it worked. And I would say over the last couple of weeks, there's been increasing information about that that has been very helpful to understand how things move so quickly. The first point I would make is that the FDA and CDC and those did a nice job of cutting a lot of red tape. So much of what holds up progress for any company is filing forms and getting approval to move to the next step and the next testing. And so having that wiped away helped move things forward very rapidly. In addition to that, many of the companies had already had a jump start in that they were concerned, having seen SARS back in, I believe, 2009 and MERS in 2012, that probably our next big epidemic or pandemic would be a coronavirus, given the threats from those. So many of the companies already had teed up a way to move forward with a coronavirus if indeed that proved to be the culprit that caused the next problem. And because of that, there was 10 years of R&D that was already done and waiting to be used. So instead of a typical 10 to 15 years to get a new vaccine to market, that really shrunk the time frame very nicely. And then with working closely where the FDA was working with them every step along the way to move this more rapidly forward, brought this to fruition much more quickly. The other thing that was very reassuring to me is how well this vaccine has been studied. So the trial groups, each about 30,000 people, are bigger, at least as big, if not bigger, than most any vaccine trials we've done before. So there is power in numbers, particularly if you're looking for side effects or unusual effects. And that's reassuring. The other reassuring issue is that usually within the first 2 months, we see side effects if they're going to happen. So 90% of side effects, and I realize that means there's still 10% out there, but 90% of side effects usually show up and typically show up in the first 2 months of vaccine use. And it's one of the reasons the FDA said they would not release it earlier than 2 months of the trials. And to date, we've seen very few concerns. There have been one-offs here and there that have disrupted some of the trials, but those have been investigated thoroughly because people do get headaches and do get other things as part of normal life. And so it does not look like there's any red flags in terms of the side effects. The other concern I had was this is different than any vaccine development we've had in terms of the technology. So in terms of this mRNA encapsulated in protein that's injected so that your cells produce the particular protein we're trying to make you immune to is something different than we've done with other vaccine development. But it's not new to medicine. It's been used in cancer, both research and in cancer therapeutics. And so it is not something that's unproven in terms of its ability to do what we want it to do. And in fact, probably part of the reason that we look at a good success rate in the trials of around 95%. Unknown if that will hold out. Once we get it into a larger population, it will be a little more difficult to measure, particularly considering you may be giving it to people, which it now has been okay to do, to give it to people that have had COVID and had the illness. But from all standpoints, looking at previous vaccines, comparing it to this, it appears to be safe. It appears to be efficacious. And I felt then that I could comfortably say this is something that I'm comfortable getting. And on an outside chance, I even happened to do my antibodies to see if perchance I had had it and not realized it, and I am negative. So I am planning on getting my vaccine, depending on where I fall in line to get that. And I don't have concerns about that. So hopefully that answers some of your questions about it. I realize there's many that just can't be answered. And this has certainly been unique for the population to follow us closely in medicine every day, with news every day about every step that's taken, and to understand how many times in medicine it is a little gray and murky. That doesn't mean we aren't searching every day to try to find those answers, but sometimes we just don't have them right at our fingertips, and we have to say we don't know, and we continue to study and learn. So for this journey, I think it's brought us to a place where we now have something that we can reach, whether it's herd immunity or at least personal immunity with the vaccine. How often will it have to be repeated beyond the first 2 doses? We don't know. Could there be long-term side effects? I'm sure that's always possible, but if you look at most other vaccines, any long-term side effects are very, very minimal and way less than actually getting the disease. And the one other comment would be is the timing. Obviously, we've had this really tear through our nation quite a bit, and so sure, it would be great if it were sooner, but there's only so fast it could happen. And so the question becomes, well, now do we really need it? And I think a very valid point that was brought up is when you look back at some of the tremendous successes we've had with measles and mumps and polio, and even teaching a class at Northwestern that I'm doing right now, looking back at diphtheria 100 years ago, there were 200,000 cases a year of diphtheria. Now, over 10 years, there's 2 or 3 or 4 at most. So the tremendous successes in eradicating and preventing disease that vaccines have, we never were able to, even in the days before vaccines, reach herd immunity for diphtheria, for measles, for polio, for chickenpox. That's why we kept seeing more and ongoing disease because of that. So we do need a vaccine to get us there, to be able to decrease the frequency and severity of this disease for our vulnerable people, for our healthcare workers, and for our general population. So all that taken together, I think this is a very good development, and one that I would certainly support and encourage people to consider and dig deeper if you still need answers, but I would encourage you to consider it.
Thanks, Dr. Laird. A lot of good stuff there. A couple things hit me as you were talking, including the fact that some may argue that we don't need the vaccine today. It's hard to envision a world right now where we don't need protection from COVID-19, right? I mean, it's
indeed.
I hope those people are right,
Yes.
but I'm not on that train, at this point. So a couple things, maybe just a couple. You touched on a couple things, and I did earlier, I think, as well too. But first of all, 16 and over is the eligible group. And there is no limit on how old, right? So 16 and older. It is not recommended at this point for pregnant females, correct? But it is being recommended now, and this is a change, but it is being recommended now, even for people that have had it that have had COVID within the last 3 months.
Yes.
Initially, it was if you're 3 months or more, you were eligible to be in first tier or be whatever, but right now they are recommending it. So even somebody like me who had it the first week in November, I would be eligible today. I'm not a tier 1, but in the second wave, I would be eligible. I don't need to wait until April, in other words.
That is exactly right, Marty. I would say that some institutions have elected to maybe not make those people first tier if
Correct.
they currently have antibodies or have had it recently because they may have their own protection, but they would be vaccinated maybe down the line, tier 2 or tier 3, something like that.
Sure. Okay. Okay. Well, again, from the perspective of Orange City Area Health System, we would certainly encourage a strong consideration for you all out there to take the vaccine, to have it administered. We believe it is safe, and we believe it is the quickest way to get back to whatever the new normal for all of us is going to be. But we're looking forward to finding out what that is, right? You know, what is the new normal? I don't know, but it's better than the normal today.
No arguments there.
Okay. Anything else, Dr. Laird, from the vaccine perspective?
No, very good. Appreciate all the hard work that the task force has done in helping us to get ready to administer this vaccine and have it available for our population, Marty.
Good. All right. Thank you. And please, again, to all of you out there, look forward to some kind of public service announcement. We'll be back in touch regarding the specifics of that, but we do anticipate that being at the latest early next week. Thanks again for joining us, and as usual, we ask you to stay strong, continue to stay vigilant in all the social distancing and hygiene things we've been talking about for too long. And of course, above all else, stay healthy. Thank you again.